The Neighborhood Health Association has provided quality primary health care to Toledo, Ohio's under- and uninsured residents for over 35 years. With many clinic locations and a senior center, NHA is the largest federally qualified community health care system in Northwest Ohio. These facilities were established not only in response to the needs of our communities, but in order to ensure that our patients continue to receive the care they deserve. NHA began in 1969 by a group of community people who wanted to make a difference, who wanted to make a change, who wanted to leave a lasting impression on the community.
The mission of the Neighborhood Health Association is pretty simple and it's pretty direct. We provide health care to anyone regardless of their ability to pay. We do that with dignity, we do that with respect, we do that trying to use the best and newest methods available in the arenas in which we are providing care, and we provide that care to absolutely anyone who needs it, regardless of their status. And I say that often because people tend not to believe that you can go someplace that will provide medical care for you, whether or not you can pay. But that's exactly what our mission requires us to do.
Medical services offered through the NHA Community Health Center Network include family practice, internal medicine, cardiology, OB/GYN, general surgery, geriatrics, pediatrics, podiatry, and midwifery. NHA also provides a certified laboratory, dental, social services, bilingual translation, immunizations, HIV testing, family planning, and a pharmacy.
The medical staff at Neighborhood Health Association is a very well-trained staff. We have primary care physicians who are board certified in pediatrics, internal medicine, and geriatrics. Additionally, we have specialty providers available to us. We have certified nurse midwives. We also have a board certified cardiologist and a board certified general surgeon that help us take care of our patients.
I've been going to the centers for at least 2.5 years. The staff has been helpful in a lot of areas. I didn't have any medical insurance and I had some medical problems. I have low income, so they're on a sliding fee scale for me, and that is the help. See, I have had a lot of experience with the pharmacy. I'm on a lot of medication, so they do help. You can't go to another pharmacy and say, well, this is how much money I have, and they'll give you on a reduced fee. My experience with NHA is very good. They're helpful. They're trying to make my health better, my life better. They're caring people.
At NHA, we pride ourselves on being a one-stop shop for our clients. Clients have access to the following services at our health centers: social work, WIC, Healthy Start Healthy Families, Perinatal Outreach Program, Sickle Cell Program of Northwest Ohio, Mildred Bayer Clinic for the Homeless, and the Mayoras Center. Our licensed social workers are available to all NHA patients and are able to assess a patient's needs to determine which information and referral services are available to assist the client with their health and well-being.
Without the social work program, they wouldn't have access to the medication programs, they wouldn't have access to the discounted medical services, they wouldn't have me as a resource to help them to navigate the community resources that are out there and available to them.
They were able to get me in even though I didn't have insurance on like a sliding scale, so I could pay less than I would if I had insurance. And the social worker also talked to me about getting my Norvasc from the company that makes it. That was the second medication I needed to lower my blood pressure, but it is lower now. But she did offer that option to me to get the medication because it's $110 a prescription. I like everything. The people are nice. They're very prompt when you call. They try to get you a appointment, or if you need to talk to the doctor, they'll take the message and someone will call you back. I like the pharmacy, that they'll give you a little, whatever that little digital thing is, and you can wait for your medication. And the prices is cheaper. The clinic, Cordelia Martin wasn't here and I wasn't offered this service, I wouldn't have been able to have have care for my blood pressure. I probably would have had to go back to Minnesota, and I wouldn't have been able to finish taking care of my mother.
I originally went to Cordelia Martin when I was pregnant for the midwives and found that there was a WIC office there, and I love the women there. I really do. They're wonderful women. They're very caring and very interested. They know me by name. They know my kids' names. And I feel very comfortable there. If there wasn't a WIC program, our family would be pretty strapped for certain things. We'd have to put bills off so that we could give our kids the milk and the cheese, make sure that they have what they need with the nutrients. We would have to really struggle to do that. Healthy Start is very, very important to my family because it means that my kids get all the health care they need. I have 3, so it's hard to think about even paying for medical bills and prescriptions because one of them is almost always sick. So I don't know what we would do without Healthy Start because we wouldn't have insurance without Healthy Start. And it's just unthinkable for me because it's so important.
The perinatal outreach program assists pregnant women to stay healthy while they're pregnant. The main goal is to reduce infant mortality. If we don't have healthy moms, we do not have healthy babies. And our objective is to get them to the services that they need in order to be healthy during their pregnancy so that they can have a healthy baby. We also follow the baby until the baby is 1 year old, following the parent doing home visits, making sure that the baby gets to the medical services that it needs and also stays caught up on the immunizations.
I've met Sheila through Cordelia Martin for the perinatal outreach program. My doctor introduced me to her. If I never met Sheila, I would have got an abortion. If I would have never gotten this program, I probably would be losing it. Because it's a struggle, it's hard. 19, 3 kids, twins. But she kept me calm, she helped me with a lot of things. So if I would have never gotten a program, I probably would have got an abortion or either be losing it.
With the sickle cell program, we provide education, advocacy, and support for those that have sickle cell, as well as their families, and we provide education to the community. I get to help people, and I get to educate people about something that they probably wouldn't have known otherwise, and that helps sickle cell in the long run. The more people that know about sickle cell, the more we are able to support the individuals that have sickle cell. My typical client is a newborn baby and his parents, just talking about the disease and educating them on what to expect and some of the problems or issues that may arise. Some fears that the parents have with a child with sickle cell is just any complications that may come about. Healthcare costs, that's a big issue. Just general support, just not knowing much about the disease at first, that's probably the biggest fear.
I was diagnosed with sickle cell when I was 2 years old. Sickle cell affects me in many ways. It affects my employment, it affects my normal day-to-day activities, it affects my hobbies. One of my pain crises was weird because I woke up in the middle of the night and I was in pain, just my legs were hurting. And I just took some pain medication they had given me at home. So I went to the emergency room, and by then I was in pain all over, from head to toe. They couldn't touch me. They couldn't touch my hair without, me screaming. And after a while, I just woke up in ICU, and they told me that my lungs had collapsed and my counts were really low. So a lot of times, just simply going to the doctor and getting treated could help you not to have to go through the worst complications that can arise from having sickle cell.
Mildred Bayer Clinic for the Homeless provides direct delivery of comprehensive health care, including medical, dental, vision, podiatry, laboratory, case management, and specialty assistance to homeless individuals and families in the Greater Toledo metropolitan area. We also provide transportation to and from medically related appointments for those who are homeless. Project Black Bag is another program operated out of the clinic. This program provides medical services to shelters on weekends. The Mayoras Senior Center has been responding to the culturally sensitive needs of Toledo's historic South End residents and providing quality services and activities in a community setting to the seniors in the area for over 25 years.
I like coming to the center because it gives me an opportunity to meet with other people my age, of course, and to also learn a little bit about other cultures. And it's just a fun place to be. And of course, this new center is fabulous. So thankful for this building. And to be alive, to be able to do the things that we do, you know, the exercises, the crafts, just the socializing. I mean, that's an important part. So the senior center affords them to forge friendships and to interact with each other.
This is an incredible service. The benefit that I've received from working here is probably greater than the benefit that most of our patients would get from coming here. I have learned, and our staff has learned, the importance of being there for people who need you to be there. We have watched our patients thrive. We have watched them take lives that were falling apart and move them into incredible positions that allow them to be, again, solid contributors to this community. This is just a wonderful place to be. Our approach to care is gentle. We treat everyone as a person. We try really hard to treat everybody as a person and not as a number in a system. We try and acknowledge that there are actual life issues that need to be considered when you're treating someone's health. Our staff is incredibly well trained. We're just very lucky in a town like Toledo to have a system like this.
Neighborhood Health Association champions the effort to provide access to quality health services by providing comprehensive medical, dental, pharmacy, and social services, as well as innovative health programs and targeted educational initiatives. Quality care, it is as simple as that.